In this section, we will discuss the function of sympathetic nervous system. As we have already discussed that preganglionic sympathetic neurons arising from the spinal cord terminate either in the paravertebral ganglionic chain in the cervical or abdominal ganglia, or in so-called terminal ganglia. Transmission of stimuli from preganglionic neuron is cholinergic. That is mediated by release of the neurotransmitter acetylcholine. But transmission of stimuli from postganglionic neuron is adrenergic. Means stimulation of all effector organs except sweat glands by the postganglionic sympathetic fibers is adrenergic. Means mediated by the release of norepinephrine. Sweat glands has exceptional case means transmission of stimuli from preganglionic neuron is cholinergic. It means it is mediated by release of neurotransmitter acetylcholine. Transmission of stimuli from postganglionic neuron is also cholinergic. It means it is mediated by release of neurotransmitter acetylcholine. Now, let's understand the function of sympathetic nervous system or effects of sympathetic nervous system on effector organs. This is postganglionic adrenergic nerve. If effector organ is eye, which has alpha-1 adrenoceptor, it causes contraction of dilator pupillae. Dilator pupillae is a ring of contractile cells within the iris. This is postganglionic adrenergic nerve. Other effect on eye is that eye also has beta-adrenoceptor. Sympathetic system causes fat accommodation of ciliary muscles. This is postganglionic adrenergic nerve. If effector organ is submandibular gland, then sympathetic system activates mucus secretion. This is postganglionic adrenergic nerve. Effector organ is heart. Heart has beta-1 and beta-2 receptors. So effect of sympathetic system on heart is that it causes increased excitability, increased myocardial contraction force, increased heart rate, and causes fast stimulus conduction. This is postganglionic adrenergic nerve. Bronchi is effector organ. Bronchi has beta-2 adrenoceptor. Sympathetic system causes dilation of bronchi. Efferent from affiliated CNS segment causes activation of sweat glands as effect on sweat glands as already been discussed in detail. Efferent from affiliated CNS segment causes contraction of hair muscles of skin. Efferent from affiliated CNS segment on blood vessels causes vasodilation. Means sympathetic cholinergic vasodilation, but not confirm in humans. This is preganglionic cholinergic nerve. This is ganglion coliacum. And these are postganglionic adrenergic nerves. In case of stomach and intestine, sympathetic system causes contraction of sphincter, which has alpha-1 receptor. Sympathetic system causes relaxation of muscles of stomach and intestine. Sympathetic system causes relaxation of gallbladder. Effect of sympathetic system on kidney is that it causes renin secretion by stimulation of beta-1 receptors. Effect of sympathetic system on pancreas is that it inhibits the secretion of insulin through alpha-2 receptors. It also inhibits the exocrine excretion. It activates the insulin secretion through beta-2 receptor in pancreas. This is preganglionic cholinergic nerve that causes activation of secretion of adrenal medulla. Sympathetic system causes contraction of splenic capsule. Effect of sympathetic system on liver is that it causes gluconeogenesis through beta-2 and alpha-1 receptors. Efferent from affiliated CNS segment causes dilation of the blood vessels in skin. Efferent from affiliated CNS segment causes lipolysis. This is preganglionic cholinergic nerves. Then there is ganglion mesentericum. These are postganglionic adrenergic nerves. It affects on genitals is ejaculation through alpha-1 adrenoceptor. It causes contraction of blood vessels of skin. It causes contraction of sphincter of urinary bladder. It causes contraction of uterus in pregnancy through alpha-1 adrenoceptor. It causes relaxation of detrusor of urinary bladder through beta-adrenoceptor. It causes relaxation of uterus through beta-2 adrenoceptor. This was all about the function of sympathetic nervous system. In our next section, we will talk about acetylcholine and cholinergic transmission.